Now, KwaZulu-Natal remains the province where COVID-19 appears to be the most rampant. There are over 67,000 active cases in that province. Thuba Vilane has been finding out how authorities and healthcare facilities are coping. He joins us now live. So, Thuba, what are unions saying, especially about the pressure on healthcare workers?
Yes, Shahan, as you understand, that the province of KwaZulu-Natal, in the past few weeks, it has seen an increasing or a sharp increase in the number of infections. So that affected and put more strain on the institution, health institution, as well as on healthcare workers. We had a chance to speak to the unions, especially Dinosa and Sama. They are saying they are strained as the health workers because the pressure within the facilities always comes to them. But on the side of Sama, they are saying that now that the communities have started realizing that this virus is deadly, and they are streaming into public facilities. But let's listen to Dr. Zanele Pigisha explaining.
It really is bad. We know notoriously ukuthi e-health has always cried ukuthi we don't have enough clinical staff. So are short in terms of warm bodies and hands on the ground. So this virus and the surge, it's actually come to amplify that bunch, because at the end of the day you are having people that are getting infected, taking them out of circulation, ngoba bako isolation. So we further are experiencing shortages. And it's happening at the worst time, because at that point in time, our numbers of foot traffic in our institutions are increasing. So it's just a recipe for disaster. But we also then have the complication of our health facilities themselves, in terms of the infrastructure to be able to handle the increased numbers. It's seriously a crisis, because we know that bed shortages are a thing. And I'm talking across the board, not just in public sector, but also in private sector. We do have the challenge where people are struggling to find beds.
And what's Dinosa saying about the department's efforts?
Dinosa had a meeting with the Department of Health yesterday, where the department was briefing union about just giving them the update, the latest update in terms of the infections in the province. But Dinosa, what they are telling us is that they are pleased with the effort that the department has put on in ensuring that the numbers do go down, as we have seen in the past few days, where the province seems to be recording a decline in terms of the new infections. But they are, however, concerned about the administration of bed allocation, as well as hospitals admissions. They are saying the department needs to improve there. We spoke to the provincial secretary of Dinosa, and this is what he had to say.
From where we are and the reports we are getting, we think we are doing okay. Because when the first wave came in, we established a lot of hospitals that were identified or they were renovated to cater for COVID. Now, the grounds or the field hospitals were also activated. Now, currently, those hospitals are being activated, but on the same vein, we think it's just a systematic problem where you find there's overload of patients. But according to bed availability, we are confident that the province is coping. It's just that it needs to redistribute patients accordingly or redivert patients. Because you find that one corner of the district is too busy and the other corner is quiet. Maybe the winner of referring patients should be also reconsidered so that you don't overburden one hospital. Also, the issue of rapid testing, we think is going to come a long way, because if you do rapid testing, the turnaround time for results is quicker. Then people don't waste more time waiting for results or not knowing what is their status, because that is what is creating a load where you find that many PUI patients are waiting for results, ending up occupying more space and mixing with the normal or known COVID patient.
And the provincial government, what are they saying about the situation?
The Premier, Shahan, is saying, yes, as the province of KwaZulu-Natal is strained, but he's saying there are beds available. Although in the past few days, the private sector or the private institution have seen an increase which has resulted in the shortage of beds. But he said the Department of Health is working together with the private hospitals to ensure that if there is a patient that is admitted or is coming from the private hospital and requires admission, those people are able to be admitted in public facilities. He's saying so the department is facilitating and working around to ensure that all beds that are available in the province are able to be used together, both by the public and the private.
All right, we can leave it right there. Thuba Vilane is in Durban.